I think for providers, the current state of healthcare is very stressed. I think oftentimes there's a feeling like you're running on a hamster wheel. More and more is being asked of you with fewer resources.
Society cannot afford to keep paying for healthcare the way we have been. In addition, I think our resources are getting more scarce, and producing more doctors to see more patients isn't going to work.
We need different outcomes. That means we must do something different. And value-based purchasing is a fundamental change that should catalyze the movement in the desired direction.
Community health centers and rural health clinics are perfectly positioned to advance the initiatives of Healthier Washington because their concern aligns perfectly with the desire to improve the health of populations.
I believe that all health centers, all rural health clinics are here to take care of their communities. Frankly, with these new methods of payment, we are incentivized to do just that. We benefit when we keep people healthy.
Value-based purchasing and APM4 should speak to our strengths as FQHCs and our history of innovation. Some of those innovations can include different kinds of health workers being involved with the patients, telehealth, more electronically facilitated interactions, engagement with patients in ways that have not traditionally been supported.
In order to best serve patients, every member of the care team needs to be working at the top of their license, doing the best they can to make sure that they contribute to what benefits the patient.
The single greatest challenge for community health centers will be to collect and report data that will demonstrate their value in providing the best care possible to their patients. I think one thing that the Healthcare Authority has done very well is to narrow our focus on metrics as a starting point for improvement of health. We need to start somewhere, and that we're all starting from the same place with the same measures is very helpful.
If we are all gathered around the same metrics, the ones that matter, and we're all pulling that direction, we're more likely to achieve those broader population health goals.
For patients, what we're talking about is care that's seamless and continuous, and the right care at the right time, the right place.
I've been very encouraged by the local and regional collaboration that's been happening at our Accountable Community of Health. I was sitting in a meeting the other day and there were representatives of all the regional hospitals, FQHCs, EMS providers, public safety, behavioral health, all sitting in a room grappling with these big issues, working together to find some way to really transform how we deliver care in our region. This is an investment in the long game. We're not necessarily going to see the desired outcomes in a year or 2 years. It may be a decade or a generation before we reap the full rewards of this investment.
I think it takes leadership and vision to say, you're right, this is uncomfortable, but we have to do this, if only for the benefit of the patients. I mean, that's why we're here.